My name is Linda Greenwell and I'm a dentist and decided to set up the Dental Wellness Trust last year. I'll tell you what we don't think about is the fact that so many people in the world do not have education on how to look after their teeth. People don't have access to running water. They have outside taps, they don't even have toilets. They have an outside tap, not even a toothbrush, and if they do have a toothbrush, they're sharing it amongst the whole family. As well as that, they don't know how to brush their teeth and they don't know the importance of looking after the mouth at all. They've got black teeth, they've got no teeth, they're in discomfort, they cannot eat, they cannot function, they're in pain, in severe pain. And this is who we are trying to help with the Dental Wellness Trust. I visited those schools and I visited and saw that the children have mass decay, black teeth, massive suffering. I've seen it for myself, and when I saw it, I said, what's being done?
When we started our project in Cape Town, it eventually got to the South African government, and they are now getting involved and looking at what the dental needs of the very underprivileged are. And if we can just help in this way as well, it's not just the money, it's the influence.
When they actually researched, they discovered there was 8.5 million teeth that have massive decay that need to be treated. But before we even start to treat the tooth decay, we need to start way before, which is the prevention. And the prevention education is a sustainable way of making sure you can make a difference to the life of a child from correct habits right from the beginning of their life. We're working in the UK, we're working in Rwanda, we're working in Kenya, in Uganda, we've done a project, South Africa, Ukraine and Israel. Our focus in the UK is our ambassador program with our education, whereby we train young students in high school to learn about dental health, learn about dental wellness, and learn how to teach brushing. And they can take that knowledge out and deliver that information to young kids and take the toothbrushes with them and go out to our different projects, teach the teachers, teach the carers, teach the older children in a peer-to-peer education. And that is new and that's not been done as far as we know in terms of dentistry. It's the first time.
It's really getting to the people who need it most, to the awful situation in Rwanda and the desperate poverty that you still have in South Africa and various other areas, and to try and get to these people and teach them the basics of oral hygiene.
Those ambassadors will develop the programs and be able to extend it to a lot more people than we can reach otherwise. We are also compiling kits, dental wellness kits, and these kits will be given to patients in hospital, people who are in shelter, to homeless people. We will be giving out toothbrushes for them to be able to look after their teeth as a basic human right. In Hadassa, we're screening the Ethiopians. They have many dental problems, but they are not used to the fact that their dentists provide the treatment. And so they leave the problems until it's extremely severe. Nobody has ever taught the children, they don't have toothbrushes, they use toothsticks. They don't know the importance of looking after their teeth. As well, I went to the old age home, which is very near Hadassa, to see the massive need in the old age home for the elderly. Many of these patients are suffering in terrible pain for a long period of time because they can't get access to dentistry. We have also worked in Ghana with Global Brigades, and we've donated toothbrushes to the King's Dental students so that they can give out toothbrushes and give the education needed. We've worked at Tick for Children's Home. We have given out toothbrushes there. We've worked in South Africa. We've given toothbrushes to the AIDS orphanage in Johannesburg, the Winnie Mambusa Trust. We've given to the Elitha Creche in Khayelitsha. We've also given to Rwanda. Our project in Rwanda, we have recently screened 1,000 orphans to assess their dental needs. Dr. Weinberg from Zurich went to screen 1,000 orphans, and they were given oral hygiene lessons by the hygienist who accompanied them on the program. and toothbrushes. We've given out 4 lots of toothbrushes, so all the children have had sustainable giving of the toothbrushes. Many of the children, it was the first time, and then they now have the knowledge on how to look after their teeth. In 5 years' time, we hope to achieve this program called Fit for Life. Fit for Life starts off by Fit for School. That involves a special program whereby children have supervised hand washing. In South Africa, there are many severe diseases, and a lot of them spread hand to hand because the hands are not washed. So in the beginning, we'll be teaching them correct hygiene, correct brushing, correct hand washing, so they can prevent diseases for the future. The program is shown in the Philippines to make a 40% difference in 1 year. So we'd like to be rolling these programs out in South Africa, in Rwanda, and in different parts of the world where there's great need. By giving a toothbrush and helping someone to look after, empowering them to look after their teeth, by showing them how to look after their teeth, I'm astounded how quickly you can make a difference to somebody's life.
You know, if one can go through life just touching a soul, just helping somebody, I think that's worth it. And for me, as a dentist, as a professional, that's what you just want to leave the world a little bit of a better place than the way you found it. And we're very privileged as professional people in this country. And I think it's incumbent on us to help the others.
We really need your help in order to make a difference for so many people. Thousands of children and vulnerable adults will be helped by your contribution tonight.